Hi, everyone. Thank you for joining us today. We're so glad to have you at this year's 2024 Wellbeing Trends to Watch. This webinar is being hosted by WebMD Health Services, and we are going to get right into it. But before we do, my name is Carson. I am a moderator for this webinar. I am really excited to dive in, and as we do, I'll just go over a quick piece of housekeeping and we'll get started. We always get this question, and I'm happy to let you know that this webinar will be recorded and you can receive a copy of the deck as well. So it will automatically be sent to you. All you have to do is keep an eye on your inbox. And when this webinar concludes, you will get the recording that you can rewatch. You can pass on to colleagues or anyone else that you might think would find this webinar informative. We are also encouraging you to please submit all of your questions to our speakers through the Q&A widget at any time during today's recording. We will have time dedicated at the end to answer those questions. So keep them coming in through the whole webinar. And lastly, we want to know what you think. We want to hear your feedback. So you can email us at the conclusion of the webinar. We'll have some information for you to reach out. There's also a little survey that pops up at the end. We always want to improve for you, for our audience. So give us your feedback at the end of the webinar. So diving in today, 2024 workplace well-being trends. This is a hot topic this time of year. To be honest, WebMD Health Services, we're not the only one talking about trends for the next year, but I have seen a sneak peek of what we're talking about today. And I can tell you, we have at least one or two things on this list that I have not seen on anyone else's list. So you're gonna wanna sit tight and see what our speakers are talking about today. We're gonna talk about the general emergence of well-being in the workforce. We're going to unveil our trends. And then we're gonna talk about how you can actually take these trends and turn them into tools to find success in the next year. So without further ado, I'm so pleased to introduce our speakers for today. Christine Muldoon, the Senior Vice President for Marketing and Strategy at WebMD Health Services, and Erin Seaverson, the Senior Director Health of Research at WebMD Health Services. And Christine, you can see, is on camera right now. So Christine, I'm gonna go ahead and pass it to you. Why don't you kick us off and let's get into it.
Thanks, Carson. I love doing our annual Trends webinar, and just based on the audience right now, your interest year after year, I think is really a true reflection of the role that well-being plays in organizations, as well as the ongoing commitment we are making to evolving employee well-being. Of course, we know that that commitment is not without some challenges. Over the last year, certainly we've faced economic pressure, the expanding role of well-being expectations from employees, as well as the impact that multiple corporate initiatives has on our overall strategy as well. So many trends we could share today, but of course, focus today is going to be on well-being and where we see it going in 2024. So just definitely want to have all of you involved. So I would love to start by asking you all a quick question. We're going to do a little different, and we're going to do an emoji type poll here. So the question for all of you is it worth investing in employee well-being? Give me a thumbs up or a thumbs down. This is really your perspective. We're just definitely interested in what your thoughts are. Not a trick question, just wanted to get a general sense based on where you all are sitting right now as you think about your well-being program, what you've invested, and do you think it's been worth that investment? So we'll just give it another couple seconds here. And let's go ahead and see where our audience is sitting with this one. Carson.
All right, Christine, so we just ended the poll and we had a couple of hundred people actually answer thumbs up, and we had 0 people. I'm not sure if I've seen that in any polls check. We had 0 people put a thumbs down.
I'm shocked.
Overwhelming responses.
And I swear it wasn't a trick question, but there was a reason why I was asking this question. When we take a look at what's going on every day at work, in our lives, there are some pretty disappointing statistics. We know employees are struggling with stress, burnout, loneliness. There was a statistic that 1 in 4 employees say their organization cares about them. and 85% of employees are not engaged in the workplace, despite all this effort that we're putting in. I'm actually happy that you all still remain very positive, because if you look at these statistics, some of you I would have expected might have been a little thumbs down, indicating that, hey, it's not worth the investment in time. They are not making my employees better. But again, just because you have a well-being program does not mean employees won't be stressed or burnt out, nor does it mean that your well-being program is failing. For some time now, and we might want to say thanks to the pandemic, whatever, we have acknowledged that providing well-being programs alongside a supportive culture is linked to increased employee engagement and productivity. But as we look back this year on how employees are essentially viewing and experiencing work and life, we're seeing trends such as silent quitting still happening, employees saying they're not thriving professionally or personally, record high levels of stress, ongoing mental health concerns, you name it. So trend number one for today's webinar is about recognizing that we need to do a better job really linking workplace well-being, employee engagement, and workplace culture. So I would say it's the full package for the 2024 workplace strategy. And I'll just offer each of you an opportunity to kind of reflect for yourselves, not that you have to answer or think, say anything out loud, but have you been in more meetings since the pandemic? I know I have. It is literally my entire day. And then I spend the late hours working on all the stuff. Maybe your organization has gone through some downsizing, or maybe even multiple phases of downsizing, which just basically adds more to employees' already overflowing plate. That work doesn't go away. And now this is a good one for you all. When you take vacation, is your culture one where people can actually be disconnected from work? And I mean seriously disconnected. The key message for this first trend is really that work remains an obstacle to well-being, despite the fact that we are promoting it. Why are well-being initiatives not getting 100% thumbs up? Well, it's because they are only half of the equation. I want to think about this for a minute. We have engagement surveys and we have well-being surveys, but we should be looking at them together really as one strategy, viewing well-being as a key part of employee engagement. And so moving forward, we're going to see more organizations next year really increasing their commitment to employee well-being by taking a deeper look at the underlying root causes that contribute to the obstacles to well-being at work. Meaning how you prepare your workforce to deliver on your business strategy really does have to consider things like, what are the expected working hours? What about unrealistic workloads or job demands? Poor work-life balance. Maybe employees are disconnected from your organization's mission and vision. Is there a sense of purpose? Do you provide opportunities for social connections or belonging at work, and so on? Now, I think this is a great way to really think about this transformation in workforce well-being. I take no responsibility for creating this grid here, if you will. This really does come from Deloitte, but it is the recognition that there needs to be a layer of organizational accountability to employee well-being. It's really a shared responsibility where the work environment becomes more conducive to our well-being. So for example, in this example, the Deloitte calls out the legacy thinking about well-being is finding a balance between work and life because they are separate. But the forward way of thinking is work is a determinant of well-being. It's part of life and it shapes our well-being. So we need to take a look at organizational structures a bit closer to continue to move the needle and improve employee well-being. So a little call to action. Why are well-being programs failing? Or, we sort of feel like maybe they are failing at points in time. This term comes from a Deloitte podcast I listened to, and it says that organizations need to take a hard look at the structures of work and the toxic rock stars who may bring in revenue but drive off talent. And it's really those toxic rock stars. It's look at your culture to understand what is contributing to or detracting from employee well-being, and really recognizing that maybe some of the long-term norms that we've had in place at our workplace need to change. This morning, I saw an article come through from HR executive, and it was a new term I hadn't heard before, and it was called well-being washing. Maybe you've heard of it. And it's when employees are presented with a false sense of support. And so basically it happens when a company appears to care about employee well-being on the surface. They offer programs, initiatives, mental health days. But when you actually dig a little deeper, you try to take advantage of those employee well-being initiatives, you still have the unrealistic workloads, the high levels of stress. You really can take a mental health day. So consider where you can start making some meaningful moves that really demonstrate better beliefs at your organization, values, and behaviors. And these have to be from the top down and integrated throughout the organization, not just surface level. Make sure everyone knows by really broadcasting or rewarding those changes. So you're really embedding that change or that transformation and making it really part of your organization. So again, the business benefits of high well-being of employees will be greatly enhanced by a strong culture of well-being and when they are really tightly connected. So that was a doozy, but that was trend number one. And Erin, we know that this first trend was hefty, but I think we are showing progress that we can make on workplace well-being. And I'm very happy to see that so many people were thumbs up, let's say. So let's move on to the next trend, which I know that we are saying it's sort of like a trends within a trend.
Yes, that's right. And good morning, everyone. Good afternoon, depending on where you're joining us from. I am clearly not on video today. I am traveling. I'm here visiting some colleagues. I'm having some really great conversations and nourishing my professional well-being, if you will. But keying into Christine's comments about workplace culture, we know it is important that a culture that prioritizes employee well-being is necessary for a happy, healthy, productive workforce. And for us to achieve this, it requires a holistic approach. And we have to think about it not just at the workplace, but at home, in the community. And as employers, as vendors and practitioners, we have a responsibility to be challenging the status quo as it relates to strategy. So thinking about well-being washing is something important. How are we moving from playing lip service to creating intentional and meaningful change? So what we wanted to do within this very big trend that really is a subset of a few is highlight some specific areas, ongoing concerns that have evolved, they have morphed in terms of the conversations we're having and how we're setting priorities around them. And I'm going to start first with a conversation around obesity. So we've been talking about obesity as a workforce issue, as a broader public health concern for a long time, and for good reason. What do we know? The prevalence of obesity has increased over the past 11 years. This is data coming from the CDC, relatively recent, showing the change in prevalence from 2011 to 2022. We skipped a couple of years in there, but just to give you a high-level view of how we've trended. It is a very busy slide, so rather than pay attention to the finer details, just focus in on the colors and specifically the areas highlighted in red. This is an indicator of states where the obesity prevalence rate is 35% or higher. And you can see there's a remarkable difference in the prevalence rates as you compare across time, as you compare across geographical regions. And it's expected by 2030 that all 50 states will be in the red, meaning there will be a prevalence rate of 35% or higher. And currently, based on data, again from CDC, as of the end of 2022, 42% of adults are obese in the United States. And we expect this rate to increase to 50% in the next 6 to 7 years, which is to say 1 in 2 adults by 2030. And we're not just seeing the prevalence of obesity increase, we're seeing the severity of obesity increase, where 1 in 4 will have severe obesity by that same time frame. And this is particularly concerning when you consider the downstream impacts. Based on research, we know that obesity is a cost driver in the sense that individuals with obesity have significantly higher medical costs compared to normal weight individuals, and that cost increase with severity. We also see impacts to productivity, to absenteeism. Research has shown an association with psychological health and well-being, including depression and overall quality of life. And really, taking this all in, it's sending a very clear message that we need to prioritize how we're addressing both the upstream and the downstream factors related to obesity. And speaking very candidly with you all, we've approached obesity from perhaps a flawed perspective or too narrow a perspective. Healthcare providers, the system as a whole, employees, employers have been thinking about obesity as a condition of personal choice, one as personal failure. And now we're starting to see a shift in that attitude and a growing acknowledgement that obesity is a complex chronic disease state. And this is an important recalibration of the mindset that will absolutely impact how we approach obesity management ongoing. Now, I can imagine you know where I'm going next, right? So one form of treatment that's getting a lot of press are the GLP-1 agonists. So this is a class of drugs used to treat diabetes and obesity. And I am absolutely certain that you have all heard the headlines, the proclamation of game-changing miracle drugs, right? I mean, I'm sure we've all seen the headlines. And while I can wrap my brain around the game-changing nature of these drugs, I have concerns about touting them as miracles. This sort of portrayal is dangerous. It sets the wrong expectations. Drugs are not meant to be a substitute for behavior. And we know that when used appropriately and with the correct dosing and in conjunction with lifestyle behavior modifications, that these medications can have a significant impact on weight loss. So again, all considered, they are a very important tool in our toolkit as we look to how we are going to support our population in addressing needs related to maintaining a healthy lifestyle related to weight. Still, there are a lot of barriers and challenges related to these medications that we'll have to work through, cost being a major part of that, impacting coverage and equity of access. There's some new data coming out of Mercer that less than half of large employers currently cover obesity drugs. There's growing interest in working to address the gaps there. So another 20% are considering adding them to the prescription drug coverage. Number of other considerations, certainly not in an exclusive list here, or comprehensive list rather, but considering eligibility and how that relates to the demand for the drugs, duration of use, long-term adherence, and long-term impact. So again, a number of things that we have to continue to address and learn about and apply that back to our strategies. But despite all of it, the emergence of these drugs alone and their evolution over time has really shifted the conversation around obesity and are presenting opportunities for meaningful change. Which gets us to our next sub-trend. Christine.
Erin, yes. Menopause is the next sub-trend of trend number 2. And we believe it really is going to be the next priority to support holistic well-being. And if you missed it, we did a 2-part series on menopause in the workplace in October and November. And I'll just quickly share some of the highlights that you need to know. First, missed work days due to menopause symptoms amount to about $1.8 billion in loss. Second, it's estimated that only 4% of US employers currently offer menopause accommodations. And third, although over 60% of working American women want menopause-specific benefits, only 14% believe employers recognize a need for such benefits. Menopause women are the fastest growing demographic in the workforce. One of the reasons we feel this is really a hot topic. Menopause does span over a number of years. So if we were to use age 50 years as a proxy for menopause, it is estimated that more than 1 million women in the US experience menopause each year. And that was your snapshot on menopause. So what are women in the workplace asking for? Well, to start, it's important to create really an open dialogue on menopause in the workplace. And really, like any other well-being initiative that you're focusing on, how do we make employees feel comfortable? We need to open up and create that dialogue. There are so many misconceptions about menopause and what women experience. And I'll give you a news flash that it's not all hot flashes. Nearly 2/3 of women say that they want some kind of menopause-related benefit. And we do believe that if you have at least a clear policy on menopause in your workplace, that is a great foundational start. Over 50% of women who have access to menopause benefits say that that kind of benefit or that access has really made a positive impact on their work. Now, if you don't have a menopause strategy in place today, you should. Women play an important role. Many are in their midlife, and it's a time when they are experiencing career success, they're in leadership roles, and they're contributors to the economy. So you should consider offering additional healthcare benefits. Those could be things like hormonal therapy, physical therapy for pelvic floor issues, access to specialists in menopause care. If you want to have a more open dialogue, maybe form an employee resource group for employees that want to talk with others about their menopause journey. This is also a great way to start normalizing the conversation in the workplace. And yes, these groups can be open to all employees that want to learn more and support their peers. It does not have to be just women or women going through menopause. Train your managers to be more educated and empathetic about menopause, and even consider menopause champions. Again, that's a great way to start opening up the dialogue. A lot of what we're talking about related to menopause applies more broadly to well-being overall as well. And even offer workplace accommodations, like things like maybe additional leave, more workplace flexible schedules, and then consider how your well-being program is inclusive of menopause-related information and support. I'll share with you at WebMD, our health coaches are trained not only to support women's hormonal health concerns, but also specifically support women going through the stages of menopause. So this is a business issue, and helping women during this phase of their life isn't just really a nice thing to do, it's critical to retaining and sustaining the engagement of women in your workforce. So you won't be wrong if you add this to your list for 2024. And then jumping to the third element of trend number 2. So we've discussed obesity management and we've discussed menopause as 2 really evolving priorities that we see happening supporting holistic well-being of people. And the last one in the second trend is healthy aging at work. Now, the life expectancy of the average American is 73 years for men and 79 years for women. Net, we're living and working longer than previous generations. However, most live till about mid-60 of those years in good health. This is what we call health span. So basically, the National Institute of Health defines health span as the period of life spent in good health, free from the chronic diseases and disabilities of aging. And that's not to be confused with lifespan, which refers simply to how long someone lives from birth to death. only 10% of a person's longevity is attributable to genetics, which means that behaviors like nutrition, fitness, sleep, stress, getting preventive care, all the things we focus on for well-being has a significant impact as well. And so the goal is to see more people live in good health longer, not only gaining more years, but more healthy years, and ultimately spending less on healthcare costs too. So what does this mean for all of you? Well, employers can really be that change towards helping employees improve their health and live towards healthier years. So, okay, let's think about right now at work. We have about 5 generations in the workplace, and by 2030, it's estimated that Gen Z will make up about 30% of the workforce in the US. So the goal is to help employees focus on healthy aging from when they enter the workforce to when they exit. And efforts that focus on things like wellness and prevention are going to help decrease the need for acute care and chronic condition management later in life. So the role well-being plays in your organization across the care continuum is important, because that really provides consistent support that really takes a holistic approach that will ultimately empower employees to living in good health longer. And Erin, we know that's absolutely what we want. So jumping to the next trend, Erin.
Yes, thank you, Christine. And I'm hoping that you're all able to see how the conversation around these issues is forcing us to change the approach that we're taking, to evolve the strategies that we're taking in terms of addressing the overall needs of our populations. And I would say, on a similar note, this next trend is very much so a tangent of that. The issue here we're focusing on is mental health. It is one that continues to demand attention. And truth be told, we really hadn't tuned in on the issue in a meaningful way until about 2020, when the pandemic hit, and it elevated these issues and forced us to be assertive in our action. And all of this attention has brought about a lot of positive efforts among employers. Even still, we have a long way to go to improve the support system for those who are struggling. In fact, some recent data coming out of Business Group on Health, 77% of large employers have reported an increase in the mental health needs among their employees, and many anticipate that these needs will continue to grow over time. So much so that mental emotional health is noted as a top issue among the workforce. And so it is essential that we're putting the attention forward. We're making this a high priority to find the creative solutions to support our populations, to support our people. And this is particularly important because what we're hearing from employees absolutely reinforces that. Over 90% of workers say that it's important to them that they work for an organization that not only values their emotional well-being, but also provides support for their emotional well-being. And what I find really interesting is we have some ongoing challenges, is what I'll say, related to this. So 87% of employees have access to offerings to support their mental emotional well-being. Less than a quarter use them. So it's a really interesting dichotomy there, where there is noted to be a lot of available resources, limited uptake of those resources. Further, there's some survey research that came from American Psychological Association just earlier this year that 43% of employees are worried that if they report a mental health issue, it would have a negative impact on them at the workplace. And so, again, we're continuing to be challenged by issues related to access, to awareness, and to stigma. And so when we look into 2024, we're going to see a greater emphasis placed on workplace culture in an effort to reduce stigma and foster a caring environment. And a lot of that is reflected in training opportunities, definitely communication opportunities, but creating a place where employees feel empowered and supported. We'll also see employers really stepping up their efforts around increasing awareness and reducing barriers, certainly reinforced by the data that we just reviewed, but looking to expand scope of service. I've heard a lot and been reading quite a bit actually about organizations taking a look at EAP, not necessarily changing the available offerings, but augmenting them with additional support. So looking at on-site and near-site counseling services. So making access easy, reducing barriers, reducing friction to gain the care that is needed. And in general, we're going to see organizations moving forward with intention and focusing on providing evidence-based solutions, far less on quantity. And again, early in 2020, we were trying to get as much out as possible to support our employees where they needed it most. Now we're really focusing on the quality of the resource. And Christine, I think our next topic is sort of an innovative lens to how we can actualize that ongoing.
Yeah, Erin, I just want to add, something that you've pointed out, and I think I've pointed out as well, is there's definitely a common theme as we talk about these different elements to the trends is, the giving employees the feeling, the comfort that, we're offering these programs, these services to improve well-being, and they won't be penalized for using them, because that all gets all the way back to that engagement challenge, that trust factor. But it also we also have to recognize that managers need to be trained on what we're offering as well, so that they can support employees too. So there's a lot of layers to everything that we are talking about here. So of course, our first three trends have been very much focused on ways to enhance and improve well-being. We definitely see overall, and you all demonstrated that too with our initial survey question, that there is a strong commitment to well-being. It's not once and done. And you do have to continue to evolve the programs and services that you put in place, which is why we see these trends happening for 24. But of course, our next trend focuses on the potential for the buzzword that's happening nowadays, artificial intelligence, to shape the future of workplace well-being. And we're going to talk about it from the perspective of both the good and the bad, because we do have to assume that you don't just implement AI, but we deploy it responsibly. And there have been a number of webinars on AI. I think there might be just 2 in itself today. But really looking at AI and the impact on healthcare. There's many new companies that are popping up as this technology really does continue to evolve. And I think it would be great, Erin, if AI can predict the next health event in our lives before it actually happens. So you're going to start us off by kind of sharing some of the positive possibilities of AI that we might bring to the world of workplace well-being.
Yes, this is really exciting technology as we think about it. And as Christine was alluding to, it is all the buzz, right? There are daily webinars, there are constant news feeds. Everyone is talking about AI. What is it? So if we haven't been living under a rock for the last few years, right, there's no doubt that you have heard of the ways that AI is impacting your lives, how it will impact your lives, how it will improve, the good, the bad, and the ugly. And the reality is there's a lot of emotion that is tied up in this technology. It is overwhelming. It is also very exciting. There's a lot of optimism wrapped around it. There's fear, there's anxiety. And some of that goes back to where where we will take this conversation in terms of the variety of perspectives that we need to take as we address opportunities related to AI. When we consider AI and its relation to workplace well-being, it's actually been around for a long time and has been used to support employee well-being. Right, we're now in hyperdrive. In general, the opportunity here is incredible, and so we're thinking and learning a lot at this point. And if I were to summarize the innovations around AI, they would map generally to improving efficiencies, lowering costs, enabling creative solutions to address complex issues, thinking about personalization, for example, early identification of disease, perhaps even reframing this to early identification of needs, and putting it into the mental health examples and thinking about how we can meaningfully intervene, leveraging AI to focus upstream before crisis occurs, before urgency hits. Can we predict what interventions will work most effectively and for whom? So AI has great potential here. We want to think about it inside the products, outside the products, within workflows. Again, lots of opportunity as it relates to process efficiencies and personalization. AI should be thought of as a tool, one tool of many that we can leverage. It is our duty, however, to really carefully consider how to use them in the most effective and responsible way. And so, Christine, I think the conversation, and it's a very dichotomous sort of conversation. There's not a lot of gray area. There's a lot of positives related to this technology, and there's a lot of concerns related to this technology.
Yes, that's right. So there are some potential downsides for the use of AI as we think about risks, challenges, and just overall concern. And again, we're just talking about this in the context of well-being. So things we need to consider. It's not perfect. So AI is only as good as the data that it is trained on. And there is that potential for inaccuracies. So there may still be a requirement for a level of human review to really validate those results. We also know that there are just some things that can't be fully automated. And well-being may be one of those for now. We always talk about at WebMD, the human experience and the touch points are so important, which is why, we do feel strongly that a digital well-being program alone may not be the best for everyone. And organizations should consider that human element, whether it be through a health coach or dedicated well-being experts or even wellness champions, because sometimes, many times, people really need that one-on-one connection, knowing the alignment with your culture. I like to say the boots on the ground individuals that are really the promoters and cheerleaders of your program, so they feel that level of trust, which will drive engagement. All of these things really will help support when you have that human element, higher levels of engagement, satisfaction, and ultimately our end goal of really supporting overall behavior change. And then there's also the trust factor. We know, right, that well-being is personal. Therefore, the data that we provide is personal. And employees may really draw the line regarding how, when, and where their private health information is utilized, particularly by their employer. And, Erin, you talked about this, like how AI holds this promise to elevate personalization in well-being, but we also have to just be cautious because it also may intimidate those who don't trust it, and really it will then ultimately become part of the problem as we're trying to drive engagement in programs. So just some things to think about. We do think that as we look at this particular trend, we'll see organizations thinking about experimenting with AI in different ways to possibly enhance the interaction, the personalization within their well-being program. But we also recognize that level of cautiousness as well, and just feeling confident in the results that come out of it. So I don't know, Erin, I think that maybe we could do a little gut check here. And this is not meant to be research, right, Erin? I'm covering you here. Not research oriented, but would just love to do a little gut check of what you all think and really how you're thinking about your program and moving into the future. So do you believe the benefits of artificial intelligence outweigh the risks I just shared for well-being programs? So, and it's pretty simple. Yes, no, and we threw a fun one in there, ask Chat GPT. So we're gonna have you all respond to this. I did, however, I was just curious. So Erin, I did actually ask Chat GPT. Can I share with you what it said?
I was here, yes.
Okay, so it said, okay, I have to read this, hold on. The impact of AI on well-being programs depends on implementation. Brilliant, isn't that what we said? When used responsibly, AI can enhance efficiency and effectiveness, but careful consideration is needed to mitigate potential risks, such as privacy concerns and bias. Balancing benefits and risks is crucial for positive outcomes in well-being initiatives. I don't know, I felt like that is exactly what we've been saying.
AI should be reminded. Yes, absolutely.
Yeah. So let's see what you all think. Yes, no, or ask Chat GPT. Can we pull up the results, Carson? All right, do you believe the benefits of AI outweigh the risks? 55% of you said no. Erin, what do you think about that?
I find that actually quite interesting. And I think some of that is because the concerns that we've noted are very significant concerns and cross-cutting of a lot of different issues. I think we have a lot that we have to learn. It is all about the integrity of the data that's feeding the tools. And so having the right infrastructure, recognizing that there is a level of human responsibility that is critical to the success of this technology is really important. There's a lot that we need to learn. And it's much like public health issues when I think about them. It's policies and practices, it's rules and regulations, it's inputs and outputs. And so I do think that obviously the conversation is not stopping here. We will continue to hear about this, and it is, the floodgates are open, and it is open door opportunities to really dig in and listen to this discussions and create frameworks that are appropriate for your organization.
Yeah, we just might see this trend on our trends list for next year, for the following year. And I guess with that, maybe we should do a little recap here. So we shared a lot, and we're not going to go through all of it again, but we'll give you the main themes you need to know as we do head into 2024. And again, these trends are very much focused on well-being and where we believe there's opportunity to continue to evolve and shape the workplace to make it better for 24. So I'll start with the first one we talked about, which is really this idea that well-being is definitely not going away. And I love that all of you were all very positive on the value of well-being programs in your organizations, despite some of the hurdles, obstacles, and challenges that we face. Well-being is effective and it will continue, but it's more than having a program. We recognize that. We have to, this is what the whole trend was about, right? We have to cultivate a work environment that really does embrace well-being, support employee well-being, really practice what you preach when it comes to well-being, and really foster a culture that supports employee well-being, and not just those toxic rock stars. So Erin, do you want to talk about the next one?
Yeah, and I'm kind of combining the middle two as we think about issues that some are newer to the conversation, some have been around for a while, as we think about supporting our employees and getting creative with our solutioning, evolving it to align to best-in-class approaches and current knowledge and current science, so taking evidence-based approaches. We talked about that specifically related to mental health, but that also applies to how we're addressing obesity, for example, and holistically taking all, it's not just thinking about how we're approaching these issues from a physical health perspective, but approaching with compassion, thinking about the humans that we are looking to support, creating a place and a space for them to feel supported as they are working to address their goals related to their health and well-being. Which gets us into then how we can really move the needle and leverage technology to elevate our progress. Christine, do you want to close us up with AI?
You bet. And I think it's just easy to say that based on our non-statistically significant survey, AI is still unfolding. And we just don't want to we're suggesting that maybe you don't put all your bets on AI just yet. Be smart, continue to research, and maybe there are elements that you start to work with. But again, we think that you have to proceed cautiously as we look at AI and the impacts that it may have on well-being in the future.
Great.
So that's our trends. And I loved having Erin do this with me yet again. It's so much fun. I know, Carson, there have been, I think, some questions coming in. So maybe you can let us know what we've got.
There have been, and thank you both so much. I thought that was super fascinating, that part at the end, especially about the AI and our poll results. In addition to the questions that are coming in, we were getting a lot of just very thoughtful comments in the chat. So thank you everyone for participating and engaging with us. So let's dive into the questions. We have quite a few, and it's not too late to submit any. So if you see that Q&A widget on your screen and you have any questions, please feel free to ask. I'm going to start back with some of our earlier question askers. So this might go back to trend 1 or 2, Christine and Erin. So the first one's coming in from William, and William asked, do you have any advice on how to have employees share information about their well-being when there might be a lack of trust in the workplace?
Really good question. I suppose share your well-being with your manager, how you're feeling maybe is what William is referring to. But regardless, it really does come down to having a supportive culture, an open culture, and creating those opportunities. So a lot of times, managers may have a sense that something's wrong. And so, having that comfort level to ask if everything's okay, but it's also creating that culture to encourage a focus on well-being. So I know you had a really rough week, Carson, prepping for this webinar, and you might be burnt out. So make sure, tonight, tomorrow in particular, just take some extra time to focus on yourself. I know that you love to do yoga, or no, you go for walks and listen to podcasts. So it's really like getting and encouraging the elements of well-being that are going to be most supportive for individuals. And we have to recognize that well-being has to have a place in the workplace. So it's recognizing when something, yes, we all will have stressful moments, big projects that we have to work on, and maybe we have to put in those extra hours. We have to acknowledge that, but we also have to acknowledge the reverse, and giving employees the opportunity to kind of decompress a little bit from some of those opportunities. So really, it does come back to having an encouraging, supportive culture. I don't know, Erin, if you would add anything more to that.
Yeah, I would. Culture is hard, right? So creating a trusting environment is one that is really important. When we think about that as it relates to well-being, it is a long-term proposition. If there is a culture where well-being maybe isn't the norm and employees really don't feel like they are in a place, in a space where they can talk openly about how they feel, it's taking a hard look internally within the organization, working to identify those determinants of work, the determinants of well-being, and starting to address those. It's normalizing the conversation, what's happening at a leadership level, what's happening at a manager level, creating space for the conversation to create that opportunity for employees to feel more open to share. If that is the expectation, it must be the expectation then set amongst leaders and managers to be open to those discussions.
I think, Erin, what you just said, sorry, Carson, I have to add to that, because it is this thing about vulnerability. And it's, we talk about leadership support, but leaders also have to show that they are vulnerable. And I'll be the first to admit when I had a really crappy day and, and like I need to go for a walk, or, it's also showing that, just because you're a leader doesn't mean that you have to be, unstoppable. We do have stress, tough days, and we also have to focus on our well-being. So when leaders show that behavior, it supports employees feeling comfortable within the environment as well.
Yeah.
Thank you both. I have one question here from Vanessa. It's regarding EAPs. And Vanessa asked, do you see rebranding of EAPs due to stigma? And I think specifically, she is referring to kind of the barrier to use of EAPs due to stigma. Erin, I'll pass it to you first. Have you seen that or heard anything about that?
Yes, actually, I feel like that has been getting a good amount of attention and fairly recent coming out of 2020, 2021. I know there's been general dissatisfaction with the utilization of EAP services. So it's almost a marketing spin. And I have to say, I am a researcher. Christine is far capable of the marketing spin on this, but it really is marketing to participants, to employees on what EAP even is and why would you use it. It's, it is a resource to support a number of different life situations. And so there are a lot of conversations about rebranding, how to best market, what's the messaging that we're wrapping around it, reducing the barriers. I mentioned friction before. That's something that we're thinking a lot about right now is how do we create the most effective path forward? And for EAP, sometimes it is just understanding what the resource is, so raising awareness to it and helping individuals understand why and when it's something that they should pay attention to. Christine, I would love your spin on this.
Yeah, I think Vanessa has a good idea there in terms of rebranding. When we talked about the trends a couple years ago, and we also did that generational research, younger generations in the workplace didn't really know what EAPs were. And that they thought they were like when you really need like a service, like when you really need support. So many were not looking at EAP as a place to go to get like just like mental health, service support, emotional health, or really understanding and educating yourself on specific topics. So I do think that that could be a strong possibility, or it's really about like re-educating EAP or EAP in addition to other benefits and well-being and all the components, the dimensions of well-being that an organization may offer too, and really kind of showcasing this as all the things that we offer to support individuals, no matter where you are, what you need, we have something really to help you. So it could be a good idea.
Mm-hmm.
All right, we have a question from Susan. This is relating to the sub trend within our second trend about obesity management. So Susan asks and says, it feels like an uphill battle in the fight against obesity when we see a lot of the media sources trending right now are tending to create the idea that obesity is okay. I think that we can all think of at least one example where we've seen that on commercials or perhaps in social media. So how can we not contradict, but how can we influence the people within our organizations that obesity can actually be a huge health risk and decrease the health span as well as your lifespan?
That is such a wonderful observation, comment, question, call it what you like. So thank you so much for submitting that. The reality is this is such a complicated issue, right? I mean, clinically we know that there are risks associated with elevated weight, and those risks increase as severity of the threshold of weight increases. And there's just a lot of science and research to back that position up. There's also awareness to the movement around health at any size. I mean, that's a real thing. Recognizing that there's a number of different factors that play into this conversation. I'm not saying that all that eloquently, but that really is the foundation. And so when we're approaching conversations around obesity, I think we also need to take that holistic lens. So what else do we know about the risk, the health status of an individual, of the population, looking beyond a single metric, a single measure, and assessing more holistically in nature? Again, they're recognizing that on the continuum of health, that there are a number of different levers that need to be explored, to pushed and pulled to help individuals along their journey. I do think that the science generally backs up clinical risks associated with the condition, although those don't necessarily present themselves for everyone who's in that. So I do think it's important that we approach from a holistic lens.
It's a really, really good point that Susan's making. And I know it was definitely hard to kind of respond to, Erin, as what you're saying too. I mean, it's a little bit of chronic condition, person's environment, the link between stress, anxiety, mental health, physical health, like it's a hard thing. And then we also layer in the factors on, being inclusive. And, even when we are communicating, we want to make sure that we are encompassing all different individuals, shape, sizes, ethnicities. So all of these things play into different elements. It's a really great point. I think it's just hard to say one way or another how we could respond to that, because it's a little bit of both.
Yeah, I think you're speaking to something that maybe all of our trends touch on, Christine and Erin, which is that they are trends and they're not facts or statements. They are not black and white. So we're very excited to see how these evolve over the next year and into 2024. We are at the top of the hour, so I want to thank everyone who joined us today for being a part of WebMD Health Services' last webinar of 2023, and we're going to have an exciting rollout of 2024 programming for you. So please keep an eye out on your inbox for more information on that. Christine and Erin, thank you for joining us, for putting time into this webinar. A couple of people have asked if you will be able to see the deck and the recording of the webinar. All of that will be available to you. Just check on your inbox a couple hours after the conclusion of this webinar. And thank you again. We hope everyone enjoys the rest of their day, and we'll see you in the next year. Take care.
Thank you.
Thank you.